Okay, well, thank you for inviting me to come talk to your class, Casey. And thanks to those of you who are able to join. I'm going to try to take over the screen and share my screen with you. I have a bit of a PowerPoint, but I'll also be switching back and forth to the PolicyMap site to actually show you some maps. I'm going to be showing you some examples of how some of our clients are using maps. And I'll walk through a couple of cases of how that gets used. I'm going to start with the more stressful, immediate, depressing things and end with some more solutions-focused ways that people have been using PolicyMap. So let me, just a quick run down the agenda. I just wanted to show you guys how you can access PolicyMap through the university library website. I'll point to a couple of the PolicyMap basics. I think that you probably are already familiar with a couple of these things. And then I'll just get into some of the cases for how some of our clients have been using PolicyMap. So I want to start out with some of the recent work that we've been doing to try to make data available so that people who are responding to the COVID-19 crisis can see who might be the most affected by the virus. I tried to start with the more stressful things and go towards some happier things. So, so we'll start there, and then I wanted to highlight just a few things that I thought might be interesting to you guys. Finding inequities. In this case, I've got an example of some racial inequities. Some ways that some of our clients use mapping data to target some of the investments that they're making in communities, and some ways that organizations use data and mapping tools to reach communities and to find out basically where people who share certain characteristics are living, so that they can make the most of their work. And then I'll show a few of the other capabilities that PolicyMap has, because Casey, did they do that assignment yet for you that you shared with me, or are they still okay?
No.
That might help you with some of your work. So ways to layer different layers together to come up with more complicated answers to questions, or answers to more complicated questions. Some of the reports that we have that you can do on neighborhoods, and then some of the ways that you can use PolicyMap to get more specific data on, say, a study area or a service area for an organization. And then I'll just mention a few things about the data for those of you who are interested in how this data gets put together, how we come across it. And then there may be some more time for questions at the end, but I'm happy to answer questions as we go as well. Okay, so first of all, how to get to PolicyMap. Start out, just go to your library's website. I put the address here. I think that should be right. And just search for it in the search bar, and you should be ready to go. So I think if the librarian set you up last week, the odds are you already have an account set up. So you should be able to get there. But if you can't for some reason, if you're having trouble right now, I have this set up that you can just sort of follow along with my presentation. You don't need to be able to get to PolicyMap yourself if it's not working for you right now. Just a few PolicyMap basics. Can you see my cursor here? Yep, okay. Just a few of the basics. I just wanted to point out our menu structure across the top, and I'll go to PolicyMap itself in a second. I wanted to point out the search bars and some of the other basics. So let me see. All right, now can you see a map of Philadelphia?
Yes.
Okay. All right, so what I was saying is, the menus are across the top, but it can be overwhelming for people. So we have two search bars, one for subject area and one for location. So this, you can type it in and it'll zoom. We also have the reset map button, which is nice. Takes you back to the main zoom extent. And then if you want to zoom in somewhere else, you can start typing and your choices will come up here. And there we go. Okay. let's see, I'll get the hang of this. Then let me go back to my slides. So those are some of the basics that'll help you kind of navigate through what I'm looking at today. So I wanted to just go through some of the examples of how people use our data in particular, and how people use really any kind of mapping platform to do their work. So we have a lot of different clients that that subscribe to PolicyMap to use the data. There's a public edition, so really anybody who wants to use it can go to policymap.com and make maps with most of the data that we have available. But we also have subscribers who have things like custom maps and can access special features and things like that. You guys, as university clients, have access to all of that stuff. So some of our clients will be from the nonprofit world, from community development corporations, from community development financial institutions, so nonprofit banks, people who make loans to communities that may not be able to get loans from a traditional bank, government agencies and offices, so all the way from local small cities to federal agencies, and then various kinds of healthcare organizations, so hospital groups, public health organizations, folks like that. So I'm just going to share with you some examples of how that mapping gets used. So that's who we make these maps for, who we make our platform for. But this is how what people are actually doing with it. So they're using our data for urban and regional planning. They're using data for public health, for affordable housing, for economic development, and just a wide range of cases. So I'll get into that in a sec. And so, I'm going to be mostly talking about PolicyMap specifically because that's what I'm the most familiar with. But really, this could be said of any kind of mapping platform, or even custom mapping applications. So.
Eliza, so when our librarian trained us, I asked him, like, can students use this once they graduate? And I don't think he thought that you had to have a subscription, but I think what you're telling us is that they're not going to have quite all of the data, but there is still capacity. So if they graduate and they go and work at an organization, there's still a fair amount of information they can still map.
Yes, so I think right now, let me switch my screen again. Find the right one. Okay, so now you're looking at Boston, I think, or you should be. So right now I am in the public edition, so I'm not signed in right now. So you can see anything here in these menus can be reached by anybody just by going to policymap.com. So like if I want to map per capita income, I can do that. It just may not have every single feature. So here, for example, I go and if I want to click on the exact numbers here, I would need to log in, but you can see that you can make a perfectly usable map right here with just the public edition. Yeah, and a lot of organizations do have a PolicyMap subscription. So even if you do, when you leave with your degree and you start working somewhere, they may have access to it as well. Yeah, so you can see most of the data. Some of the data here is grayed out. That's usually data that we have created in-house or that we have paid for, and so whoever we licensed it from won't allow us to just share it with publicly. So some of these things that we've worked on, but you can see most of the data here in our menus can be accessed through the public edition. We switch back again. Okay. Try to, oh, come on. Okay, here we go. Like I said, I'm going to start with the sort of more, at least to me, stressful, immediate applications. This week, in the past 3 to 4 weeks that we've been working from home, we've been working on trying to make as much data available to folks who are responding to the COVID-19 crisis. So what we've done, you can see we made a little section in our menu. We're going to come out with actually a fully public-facing tool soon that makes any data that is relevant to the crisis available publicly, including things that we normally hide behind the paywall and make available through subscriptions, which is, you know, a lot of groups are doing similar things, trying to make as much information as publicly available as possible so that people can access that data. So one of the things we've done is taken this you can see is another example of that kind of thing. The New York Times has done some great work in pulling together as much reporting as they possibly can across the country of reported COVID-19 cases and deaths. So you can see here, I think this is showing 1 week, yes, 1 week change in cases of COVID-19, and this is data that we're updating daily. So you can see folks at a national government agency or public health officials can take a look at a map like this and combine it with lots of different data on, say, the availability of hospital beds, things like that. It's where they can see where hotspots are starting to crop up. So you can see a few areas here around Louisiana, around Florida. We all, I think, are familiar with the sort of Northeast corridor, but you can see that Detroit, Chicago, some of these larger and even some of the smaller cities in the middle of the country are starting to see their number of cases skyrocket as well. Here's a specific example. We've heard local reporting from Chicago that very highly disproportionate numbers, they're seeing severe symptoms of COVID-19, including higher death rates among their African-American population than as a whole. So the statistic I pulled was that 70% of those who died from COVID-19 were African-American, whereas in the population of Chicago as a whole, it's only 30% African-American. So you can see there's something going on here, going on in Chicago. There is a recent CDC finding that shows that Black patients are disproportionately likely to need hospitalization from COVID-19 as well. So there is some kind of racial disparity. So what I've shown you here is a zoom in of Chicago. This is a map of predominant race and ethnicity in Chicago. So you can see some areas that are the sort of northern area, which is predominantly white. You can see 2 areas that are predominantly Black and another 2 that are predominantly Hispanic or Latino. So just kind of keep that in mind. Let's see. As you look at another map. So then we start to think about, okay, well, why would that be happening? Here's an example of one of the underlying health conditions that we know can lead to severe symptoms from COVID-19. You can see it's not only is it only minority neighborhoods, but is specifically the Black and African-American, predominantly Black and African-American neighborhoods that experience those high rates of hypertension, which the CDC also found folks tend to have bad results from COVID-19 when they have hypertension. And so then, you know, you drill down further. Okay, well, why do we see that correlation between the Black community and hypertension? Well, there are a number of underlying factors that contribute there, but here's one of the possibilities. This is a map of low supermarket access in Chicago, where the darker purple areas are places where it's harder for people to get to a full service supermarket. So supermarkets that are larger and have more affordable fruits and vegetables and milk and whole foods like that. And you can see here, again, this is specific to the Black and African-American communities, not to the predominantly white or Latino communities. So that's an example. So I think there's a lot of attention on this at the moment. A lot of it is focusing on those underlying health conditions without really going that further step and exploring some of those inequities that are leading to those underlying health conditions, which are really just being exacerbated and highlighted by this new virus. Okay, here's another sort of use case for mapping around COVID-19. This is probably at the forefront of you guys' minds right now. COVID-19 and online education. So what do we expect to see there? This is just a map of the country of people with at least a high school diploma. So here you can see the paler areas in the south and in parts of Texas are areas where there are more people who don't have a high school education. And this, when it says people, this means adults. This is only including people over the age of, I believe, 24. So we're not counting children here who are still in school. And here you can see a map of households without access to any kind of computer. And so since libraries are closed, that really limits people's options for online education. And I also want to say here that this data defines a computer really loosely. So this includes smartphones. So this is without any kind of computer or any kind of computing device. So no tablets. These folks don't have tablets. These are folks who don't have you know, a smartphone where they can access the internet. So they would not be able to participate in a lecture like this one. And you can see in some cases it's the darkest purple is 22% or more. So some of those places it's, you know, 1 in 4 households may not have any access to that technology. And similarly, here's a map of households without broadband internet. So without the fast internet that makes streaming and things like that possible. So we can put this information together and we can, you know, it gives us a really strong suggestion that some of those areas that are already having a hard time, where folks are already having a hard time graduating from high school may end up being even more delayed in their education because of, you know, this period of who knows how many months of public school students not being able to get their education in person. So like I said, these are sort of the identifying a problem using mapping. So we're gonna move on. We're in the middle of this. I don't have great examples of ways people are solving these problems right now because we're really just in the depths of it at the moment. As we move on, I'll show you some more cases where people are using mapping and actually solving some of the problems that they're seeing through mapping as well. Any questions so far on any of this? I'm going really fast, but I've also embedded links into all of these. So I'll share the presentation with Casey and then you'll be able to click on these images and it'll take you to maps and you'll be able to play around and explore. Questions? Okay. All right, so another example of finding inequities. This is an example from the housing world. So this is an example of some data that we've worked on at PolicyMap. The purple map you can see is some data that I actually just pulled together in the fall out of some mortgage application data that is available across the country. Pulled together percentages of home loan applications that were denied in 2018. And again, if you look at a map of predominant race and ethnicity, you can see that the places where more people are white, more people are also getting mortgages. And keep in mind that this is of home loans that were denied. So these are places where people are applying for mortgages. And if you apply to a mortgage, you kind of expect that you have a likelihood of getting a mortgage. So it's already narrowing down the pool. It's sort of a self-selecting group of people. And so you can imagine that this sort of calculation of creditworthiness, there's definitely a racial inequity here. Part of the reason this data exists is because of what's called the Home Mortgage Disclosure Act, which means that banks and lending institutions basically need to show that they are no longer enforcing redlining. Have you discussed redlining yet, or are you folks familiar?
It's something that we've talked about in this class. I'm curious about like folks' experience or knowledge about it. You can put it in the chat box. What are people's understanding of what redlining is? I think hopefully you've talked about it in your policy classes. Familiar with it?
I'll actually pop up the redline map. We have it in PolicyMap, so I'll go to Philadelphia. I'll share the screen in a sec.
Yeah, I feel like there's some like classic maps of Philadelphia and redlining.
Yeah, I've got it here. Hold on a sec. All right. So here is, can you all see it? It's very colorful map of Philly. All right. It might make me sign in. Yep. Okay. So you can see this is the Homeowners Loan Corporation risk map. So this is a map from the early 20th century. Let me actually log in.
Wow, that's scary how much that maps on to what it looks like today.
Yeah, in some places it's really, really stark. Here you can see, let's see, this part, this area. I have, aha, here we go. The red area. So it's a literal, when people say redlining, it's very literal. Like the lines on the map, you know, this is the red line. And so these were areas that were marked out on a map in these different colors, and they were areas where banks would routinely deny mortgages to people who were applying for mortgages. So you can see that a lot of these issues, you know, I showed you a map of where mortgages are being denied today, and it looks very similar. It's not exactly the same. There's some a lot of places in Center City that are really more sort of desirable now and wouldn't be considered hazardous if they were to remake these today. But some of the reasons that, you know, at least in some of the early maps, the areas were considered hazardous specifically because they had high minority populations. So you can see some of these inequities and some of these effects are really, really long lasting. So because of this practice, this historic practice, there were some laws created to try to prevent this, one of which was that lending institutions have to show that they're making loans in some of those places. And so that's why some of this data is available. Now it's still showing some problems here, but the fact that the data exists at all, I think is somewhat promising. Let's see, I'm gonna try to reshare my screen here. There we go. Okay. All right, so finding inequities, that's a bit of a downer, but like I said, because of some of this historic and geographically based bigoted lending practices, banks now have to prove that they're making loans in some of these areas where they wouldn't have been before, although you can see there's still plenty of work to go. Another use for mapping in general and PolicyMap specifically is targeting investments. So we have a lot of clients who are with housing agencies or housing finance agencies, so groups that really build affordable housing, really are basically nonprofit developers who make sure that there are developments going up that have at least a large percentage of housing reserved for people and families with lower incomes. And so they turn to maps like this to figure out where they need to be focusing their efforts. So they'll take a map like this, and I'll explain it in a second, and they'll overlay their investments on it, and they'll see where there might be areas where they could be making more investments. So where could they be building more affordable housing units and apartment buildings. So this map is, the terms are a little bit jargony, but the concept is pretty straightforward. So these are people who rent their homes who are what is called cost burden. So cost burden by housing means they're spending more than 30% of their household income on rent. So if you think about, yearly household income, take 30% of that, divide it by 12, and if the rent is higher than that, then they're considered to be cost burden. There's another metric called extremely cost burden, where people are spending more than 50% of their household income on rent, and the map looks pretty similar. So you can see areas of Philadelphia here where housing is expensive in comparison to people's income.
Eliza, there was a question around like the ethics of like making some of this data available, and if people can use maybe not this map, but like other maps to segregate themselves or to avoid things that could, and they're like avoid investing in communities that like need investments or something like that.
Yeah, that can be really challenging. I'm trying to think, there have been programs where mapping like that has ended up backfiring. And I'm trying to think, there's a specific example. Basically, there are a lot of different programs where, there will be some kind of government-backed loan program, for example, where either, by the city or wherever that, investments have to be made in areas that meet some kind of threshold, like maybe only in areas where 50% or more of the renters are cost burdened. And there have been cases documented where, say, unscrupulous developers might specifically avoid some of those areas. That happens. I think that it can also happen. So what you'll see here is that these are census tracts, these little neighborhood delineations here. There's also been some slight scandals around the, I say slight because they're not widespread. So they're, I think, big problems, but they're only in certain parts of the country, where if some of these tracts are drawn in a certain way that include both a high poverty area and a more wealthy area, or a place that's rapidly gentrifying, some federal programs, such as the Opportunity Zone program, which is a fairly new program that's meant to attract investment in lower income areas, are being used in a way to sort of basically as sort of gentrification engines, right? So to invest specifically in areas that they think are prone to rapid increases in their returns, rather than actually helping the people who are living in the area. So maybe locating a business that they know might bring in employees from somewhere else, rather than create jobs locally, things like that. So yeah, I mean, that's very possible. It's something that we're aware of. I think among our clients in particular, I think it's hopefully pretty rare, because we tend to serve government agencies whose express missions are, funding affordable housing and putting units in service and things like that. But that's definitely something we think of. I mean, that's what redlining was in the first place. It's, drawing places on the map that are supposedly poor investments, and we know that the reason for those, that those areas were considered hazardous, was partly because of the races or ethnicities or languages spoken at home of the people who are living there.
Eliza, do you know if do census tracts ever change?
They do. They change every 10 years. Well, they change a little more frequently than that, but that's pretty rare. So yeah, so these are the 2010 census tracts. And so there are already 2020 census tracts. I don't know what they look like, but yeah, so in a couple years when the 2020 data comes out, the little boxes will look a little bit different. Yep. I think generally what happens is the census tries to work with local cities and towns to define the tracts in a way that makes sense. So it's not just sort of random. They try to make the tracts have roughly an equivalent number of people in them, so that maps like this make sense. But beyond that, they try to get input on, you know, what boundaries actually make sense from the perspective of like mapping neighborhoods in a coherent way. So you shouldn't really have a case that's like 50% in like straddling two extremely different neighborhoods. It's not really supposed to happen, but a lot can change in 10 years. So you might have a case where that's occurring. Great question, Casey. All right, so that's.
I take credit for that. That was coming from our chat.
Oh, great question, chat person, whoever chatted that.
Emily,
yeah. Okay, so yeah, I mean, so this is one example of a data set that can be used to target investments. Here's another example. This one is from my own experience before I actually worked at PolicyMap, where we were doing I was working for a regional planning agency, and we were trying to make a plan for the towns of Brookline and Newton in Boston, which are here and here. And we wanted to conduct a series of community meetings, and we were trying to bring together a representative group of just a broad group of community members, and we wanted to provide translation services for those who needed it. And so, you know, most of our work had taken place in cities of Boston, Chelsea, Everett. So what we needed to know was, okay, well, besides English, like what are we most likely, what groups of people are we most likely going to need translation services for? And so when we looked into the data, we found that the most commonly spoken language in those areas was actually Chinese languages. So that changed our approach. We were aware in places like Quincy of a really vibrant Chinese speaking community. We were aware of some of these Russian speaking areas in Newton and in Brookline, but what we didn't know was that the second most commonly language spoken at home was Chinese languages. So that really guided our efforts to reach people with our plan. Another example, I didn't put a map of this on here, but I think it's a really interesting one. The City of Baltimore's library system used some of our data, some of this same kind of data, predominant language spoken at home data, to determine where they should put their collection of Russian language materials. So they had a collection of Russian language materials, and they needed to figure out which branch of the Baltimore City Library it should go in. Where is it most likely to be used? And so they were able to use the same data to pinpoint where to put that material. So nice and simple and highly impactful. Okay, so I'm gonna go switch back to PolicyMap. I'm not sure how we are in time because I don't, how are we for timing, Casey? Should I?
Probably like about 10 more minutes.
Okay. Okay, so I'll just show a couple of more features of PolicyMap. You may have already seen some of this last week with the librarian. And then I will open it up to questions. So let's see, PolicyMap. Okay, can you see PolicyMap now? Yeah, okay. So here's our map of the redlining. Let's see. But I want to show you our multi-layer maps. So let's see. So this is a feature, I'm not sure if anyone, did the librarian show you this last week?
We stopped him because we were getting overwhelmed with the
It's a lot. It's
the
a lot.
features. Yeah, yeah.
Yeah, so I've been trying to show you maps where sort of the story really jumps out at you. But sometimes you'll find that maybe there's something a little more complicated going on. So I just wanted to show you, oh, I know what I wanted to show you. So Philadelphia, I'm fairly new to Philadelphia, but one of the interesting things about Philly that I'm learning is that it has a high home ownership rate. So let's take a look at that. So I'm gonna use 3-layer maps here, and let's look at home ownership. Let's see. Owners and renters. So looks solid purple, and the reason for that is because I've got 0 to 100. So yeah, everywhere has some percentage of people who own homes. But let's see. Let's go up to 50. 50%. So you can see it's a lot, it's a fair amount of the city. I'm going to add the boundaries of the city so you can see. Maybe I'll do counties. Okay, so here you can see the boundary of the city. So you can see a lot of places within the city limits, more than half of people own homes, or more than half of households own their home, I should say. And that is true of lower income people as well as higher income people, which I think is really interesting. And that is not true of many cities. Median household income. I just looked up earlier today that the median household income in the US is around $60,000. This is household income, not per capita income. And you can see the map didn't really change a huge amount. So people who have households that have incomes below the national median in the city of Philadelphia are also fairly likely to own their own home. And you can see that all of the suburbs disappeared when I did that. So you can see these wealthier areas with high home ownership rates. But then, you know, as we decrease this number and get to somewhere approaching middle income, right? We're still in pretty high income territory here, but you can see it's kind of contracting. And then 60,000, that is middle income for the United States. That's the median income. So you can see within the city, home ownership is attainable, or at least in some areas, for lower income people, partly because we have a high single family housing stock, a lot of single family housing units. And I can actually layer that on here too. Single family, let's do all single family. Single family homes. I didn't test this out, so I have no idea what numbers make sense here. Yep, so you can see these areas in purple have high home ownership rates because they have high rates of single family homes.
When you say single family homes, does that not include like row houses?
It includes row houses, yeah. So there is here single family. You can separate them out somewhere in here. Housing units. Single family detached versus attached, and I think attached refers to row houses, although you'd need to probably look into that more. So we have places where you can click and find that information. Yeah, so that's an example of a 3-layer map. You can imagine that you could use this to find areas that are in the most need of services. So places that have, say, high rates of housing insecurity, low incomes. If you have a particular program in mind that has a group you're trying to target, say Spanish-speaking population in an area that has lots of older people, that's a great way to use the 3-layer maps. So I just wanted to show you just a couple more things, and then I'll open it up for questions again. Let's see, reports. I wanted to show you reports. So let's pick a spot. I'll pick a spot near my neighborhood. So here's where we are. Here's where I am. Not quite. I'm a couple tracts over, but I'm near there. So you can see, here I'm signed in, so I can see the exact home ownership rates. It's a high ownership rate, nearly 60%. Median household income is pretty low. It's about half of what the national median household income is. And it's also got a high percent of homes that are single family homes, like the one I'm sitting in. So I'm going to switch over and get the report, and let's start with just a community profile. Let's see. I'm going to click preview report area. There's a close-up, and I'm going to generate the report. And this is where we get beyond mapping. So there is some mapping here, but there's also other data visualizations. See a lot of charts. It's still generating. Somewhere down here we have some more. So interesting information on employment, employment by occupation, crime rates, etc. So you can see lots of information here on that. I want to show you, though, slightly more interesting. Okay, we'll do the same tract. I'll get a different report. I'll get the community health report. This one's a little newer and a little prettier, I think. Here we go. So we're starting to see changes in population by age. So you can see it's mostly working age folks, a relatively high percentage of children. Racial composition and change over time, although we only have 3 data points, so it's not terribly interesting. A few more pieces of information. So number of dentists. So can people go to the dentist or the doctor in this neighborhood? Access to health insurance. Here's a big one. You can see this is the census tract compared to Philadelphia in general. You can see that there's a lower percentage of people who have private insurance, and that means insurance through their employer, than for Pennsylvania as a whole. And you can see that it's in a medically underserved area. So here's just kind of this general summary statistics that we pulled together that we thought people would be interested in. Here's a pretty depressing one. It looks like this tract has a higher than, it's a pretty high rate of prostate cancer as compared with the city and as compared with Pennsylvania and the United States. So this is Philadelphia compared with the state and compared with the US as a whole. And then finally, I just wanted to show you that you can pull together different groups of tracts using custom regions to come up with report areas. So I have a few that I think are, let's see, looks like I made one around Drexel's campus. So you can see here's a custom region, and if I click, I can get reports on that region too. And so you can make a radius, you can put together a few tracts into, say, a study area or a focus area. If you work for a nonprofit, if you have a, a target service area, you can pull together all the census tracts that are in that area, and you can find out quick statistics on that. Yeah, so that's all I wanted to show you for today. So are there any questions?
There was a question in the chat about, like, can you look at it for a single year? I'm guessing maybe it's census data, maybe it's 10 years, but I don't know.
Yeah, so let's see. It depends on the data set. Most of the data that I've been showing you is from the Census Bureau's American Community Survey program. So that is, it's distinct from the complete census, the every 10-year census that we're all familiar with, that hopefully most of you have responded to now, or someone else in your household has responded to. Each year, the Census Bureau sends out a survey to thousands of households across the U.S., and it's a really extensive survey. So they ask all kinds of questions. The census, if you filled it out, every 10-year census only has, I think, 6 questions on it about, age of people there, race of people there. There's a couple other things that they ask, but not very much. So this survey program is where you get information on income, on internet access, on language, on any of those specifics. And so you can see over here, 14 to 18, that's what that means. It means that they have to group together those responses in order to get reliable data for really small areas, because they're only asking 1 or 2 people out of, say, 1,000. So they have to pool together those responses in order to come up with something reliable. But you can see that other data sets. So if I go to the tax data and I look at, well, let me just search for this, earned income tax credit. So if you're not familiar with this program, it is basically a way for the US government to get money back into the hands of people who have jobs and are filing taxes but make lower incomes. Let's see, come on. Earned income tax credit. Let's go with this amount. Okay, so percentage of returns with earned income tax credit. So this is an example of areas where people tend to have jobs, but those jobs are lower paying. And here you can see that we do have annual data here. And you can see that we do have this function where you can look at change over time as well.
I know this is a little bit outside of PolicyMap, but there's a question about, is there any data on how many people actually complete the census survey? I did mine, but I don't know if I did it in the past, and I wouldn't be surprised if a lot of people just don't.
Yeah, that's a great question. Especially since it's, highly relevant at the moment, because we have this new census going on, which who knows how that's going to be affected. I think it's going to be kind of, we'll have to wait and see. So we do have a little bit of data on that. Mostly it's data that's been gathered in order to inform how the Census Bureau itself, and also how local government entities are working to make sure people are filling out the census. The census this time is meant to be primarily online. And if you remember the maps I showed you of computer access and internet access, broadband access, that means that there are places in the US that aren't going to be well reached. And those are tend to be the places where you really want to make sure people are getting counted, because we need to make sure federal funding is getting to those places. So let's see, where would that be? Probably, I'm going to guess federal programs. And if I can't find it, I'm going to go to search. Yeah, I don't see it right here. Census low response score. So this is, we have a few different indicators on this. This, it looks like, you can see if you click here, you get a little description. Okay, so this is what the census has said. Okay, well, these are places where we have had lower response rates in the past, and so we consider them to be, their term is hard to survey populations. Looks like this is data that they modeled based on responses to their survey, their American Community Survey. So you can see, you know, some of these places that have this, these higher numbers. In this case, it's a little counterintuitive, but a higher number means, I think, a worse score. Let's see. Yeah. These tend to be places that you want to make sure are counted. So community organizations in these areas might need to make an extra effort, or the Census Bureau may need to, you know, I think ordinarily they would send extra people to these neighborhoods to count people, to go around door to door. That's not happening right now. I haven't been keeping close track of what they're doing, but my guess is that they'll need to partner with local organizations even more than they ordinarily would, to make sure that people are getting fully counted, so that federal funding can get to these places.
Well, thank you. I really appreciate. Any last questions before we have to move on to our other community-related topics tonight? Well, I'm sure I can always reach out if something does come up. We've got our librarian, but if there's any other kind of PolicyMap specific things.
And anybody's welcome to send me an email. My email address is eliza.wallace@policymap.com. And definitely play around with it. If there's any features you can't figure out, we have pretty good tech support, customer support. One thing to mention is that this platform is what we're calling our legacy platform. This is a very weird time for us at PolicyMap, partly because we're dealing with the same things everybody else is dealing with, working from home, trying to get this data around this novel virus into the hands of the people who need it. But it's also, at the same time, we're launching our new platform. So starting, I think, tomorrow night, actually, you'll be able to access the beta version of the new PolicyMap, which is going to be a lot slicker looking. It's going to have some fancier features, particularly with regards to showing change over time and things like that. So definitely take a look next week at the beta version. I think you'll find it even. It makes for some really nice presentations of mapping that you can that you'll be able to print and put into presentations or into reports or anything like that. So yeah, thank you, Casey. Thank you for having me. I hope I get to see you at the gym before too long. And thanks everybody for being patient with my technology challenges.
Yeah,
and thanks for all the excellent questions. They were all very good questions, so I'm impressed. Thanks.
We're getting a lot of thank yous in our chat box. So
okay, great.